Welcome everyone to tonight's webinar, Your Future in Skin Cancer Medicine, a live Q&A webinar. So a slightly different format to what we have done in the past, more interaction, more chat, and a chance for you to have your questions answered. So I'm Lynette Hunt, I'm the CEO of the Skin Cancer College Australasia. I will be your host for tonight. But before we get stuck into tonight's topic, just a few quick tips on how to get the most out of your webinar experience. So first of all, locate your webinar control panel. It should appear in the top right-hand corner of your screen, and it looks a little bit like this. If you want to minimize that webinar control panel, click the orange arrow in the top strip of little icons, and that's pretty much all that you need to be able to do. You can move that panel around on the screen to a more convenient spot if you like. If you are having trouble with your audio, there is an audio settings section on that control panel. So you need to select computer audio. If you would like to ask a question during tonight's webinar, we invite you to do that in writing. So you'll see there's a questions panel. You enter your question into the blue area on that box. You press the green send button. And if we get time, responses to your questions will appear in writing in that purple section on that panel. Now, we've got people working in the background tonight, receiving and collating questions, and they will answer as many as possible, but we don't promise to answer every question, but we will record or capture every question. So if your question is not answered tonight, we will be able to get back to you in the following days to follow up. Okay, well, a warm welcome to everyone who is listening tonight across Australia and New Zealand. For those of you who may be unfamiliar with the Skin Cancer College, our goal is to support primary care practitioners to improve their skills in diagnosing and treating skin cancer. And we do this mainly by providing high quality evidence-based education. But we're much more than just an education provider. We are a peak professional body, a home, if you like, for anyone with an interest in skin cancer medicine. We like to think that we provide opportunities for lifelong learning and career support, career progression. We're active in advocacy and also in setting standards within the field of skin cancer medicine. We're also active in educating the community about the importance of early detection of skin cancer. We are passionate about achieving recognition for you, the people, the doctors and nurses who are providing that vital service of diagnosing and treating skin cancers in the primary care setting. It is, after all, the most common cancer in both Australia and New Zealand. Our aim tonight is to open your eyes to the education opportunities that are available to you to improve your skills in the area of skin cancer medicine. Before we get into tonight's webinar, I'd like to just thank our sponsors for tonight, SunDoctors, and we've got a quick little video message they would like you to watch.
Hi, I'm Dr. Bill Anseline and welcome to SunDoctors. What do I like about SunDoctors? Well, a myriad of things. What I like is the fact that they're now putting a training package together. The other thing that I like is they have a very experienced staff. They have great practice managers and they have great nursing staff, which are part of the support network that you need to become efficient to give you patient outcomes. So I'm looking forward to seeing you, I'm looking forward to meeting you, and also to training and supporting you. All the best.
Okay, thank you, Sun Doctors. Right, now tonight we do encourage you to ask questions. So please remember, keep those questions coming in through the questions panel. Right, now it's my pleasure to introduce tonight's panelists. All three are members of the Skin Cancer College. All of them have a passion for skin cancer medicine, but each of them is at a different stage in their career path and has followed a different path to get where they are right now. So our panelists this evening are Dr. Melanie Steenberg from Queensland, Dr. Charles Ayesa, who's based in Sydney, New South Wales, and Dr. Franz Strijdom, who is in Tauranga, in the Bay of Plenty region in New Zealand. Welcome, everyone. Melanie, can I start by inviting you to just provide a quick overview of your experience in an interest in skin cancer medicine and what it means to you? Thanks, Melanie. I think you're muted.
Hey, thanks, Lynette. Hello, everyone. I'm Melanie, and I worked as a GP for 22 years now. I completed my medical degree in South Africa, and I worked there for about 3 years. And then me and my husband moved to Canada, and we worked there for 14 years. I worked mostly as a GP, but also in hospitals doing women's health, mental health, some skin cancer medicine, and I also had a cosmetic clinic in Canada. And then in 2014, we decided to move to Australia. I worked in general practice again, but I realized that that was not my passion. I really wanted to do more work in skin cancer. So I did take a little bit of time away from practice to look at different options and to decide what the best path would be. So that's when I realized that a lot of GPs would like to do skin cancer, and there's a lot of competition for skin cancer jobs. So I realized that I had to up my game a little bit. So I really decided that I would like to be a skin cancer doctor. So that's a goal that I set for myself. So I entered GP practice again, and I had to do some general medicine, so I could only do about 20% of skin cancer at the time. So I looked at options and discovered the Skin Cancer College of Australasia. And I saw that I could join and work my way up to become an accredited skin cancer doctor. So I started with doing one course at a time, still working at GP practice, with the goal that eventually I would be able to mostly do skin cancer. So after I've completed a few of my courses, I looked around for clinics in our area that concentrated on skin cancer medicine, and I was lucky enough to apply for a job in November of last year, and started working at a skin cancer clinic 2 days a week. I really enjoyed it and things went well. So at the end of last year, I resigned my position at the normal GP clinic, and now I'm mostly doing skin cancer work. I worked through all my courses, and I did my advanced certificate through the college now from February until the end of July. It was a 20-week course. And yes, I'm very happy to now say that I am finally a skin cancer doctor, accredited, and that's my path.
Great, thank you. Thanks, Melanie, and congratulations on becoming an accredited skin cancer doctor.
Thanks,
Now,
Lynette.
Charles, you are slightly more advanced in your career. You're actually a fellow of the Skin Cancer College, and you're also one of our esteemed blog authors. So please tell us a little bit about how you came to this position in your career.
Sure. Hi, everyone. So, yes, my name is Charles D'Essa. So, as Annette pointed out, I'm one of the fellows of the Skin Cancer College, and I also wear a few hats through the Skin Cancer College, but I'm also a tutor for the Advanced Clinical Certificate of Skin Cancer Medicine and Surgery, lecturer for the Certificate of Dermoscopy, and one of the blog authors. So it's one of the things I started off in my journey in skin cancer medicine quite early on, actually, in my, I guess, specialty training. I've always had a special interest in the procedural side of medicine, and even as a medical student, wanted to do surgery, loved theatre, loved being in theatre, and found I ended up doing GP training and found that that general practice and primary care is the front line for skin cancer management and diagnosis here in Australia and obviously in New Zealand. And I found out that through my GP training, I ended up working at a skin cancer clinic here in Sydney, which I still work at now with two of the other fellows of the college. And one of them provided a lot of mentorship for me early on, and found that that's what I wanted to pursue, and that really here in this country and in Australia and New Zealand, we're only really limited by our skill and our understanding of skin cancer medicine in terms of what we can do. And I found the more and more that I practiced and studied and did the courses, the less I would have to refer more advanced cases. And I guess that's the level that you're trying to get to with these courses. You're trying to upskill in your diagnostic side with the use of the dermatoscope, obviously, and your surgical side, so that one day not only can you manage most things probably yourself, but also you're more appropriately trained to know when you should appropriately refer off, that you shouldn't handle certain cases, and you should refer them and share that care with the patient. So that's just as important. So I basically started the education journey quite early. I started at the certificate level and advanced through to the advanced clinical certificate level, and naturally kept going and did my fellowship, and here I am now. And what it affords me now is I'm able to give back what I know, and I'm able to I do enjoy teaching, and I find skin cancer medicine personally a fulfilling and gratifying career, and I do like to teach. So being a fellow, it does allow me to teach other doctors who want to become skin cancer doctors, I guess the tricks of the trade and all that sort of thing, which I find quite gratifying. So so I guess the main thing is knowing the skills that can get you to this stage, especially when you're training to do more advanced procedures like skin flaps and grafts. The courses the Skin Cancer College provides, obviously they help you along that pathway. And obviously if you do have other people in your practice that also are skilled in that, obviously that's all a help as well. So it provides a good pathway. And the attendance of courses, workshops and events, particularly organised by the Skin Cancer College, it allows you to network with other doctors, like-minded in the skin cancer domain. So you learn from their experience, and then eventually you can have that opportunity to give back, and they can learn from you as well.
That's great. Thank you, Charles. Thank you. And finally, Franz, as a more senior member of the college, a fellow of the college also, but someone who's been a fellow for quite a bit longer, please give us a little bit of an update on how you came to be a full-time skin cancer doctor and now very much a referral doctor within your local community.
Thank you, Lynette, and thank you everyone else. Yes, it's been a long and interesting journey. It started before I did medicine even, and I was working in Cape Town as doing medical research and teaching. My love for teaching started there. I then just started doing medicine, did medicine at Stellenbosch University in Cape Town, qualified, worked quite a few different registrar posts. During that time, I was lucky enough to have a bursary with one of our South African mining companies and got lots of experience through them. I immigrated to New Zealand in 1999 and again, did a few registrar posts here before settling down to become a GP. Quickly found that GP work was very interesting and I enjoyed it immensely. I enjoyed the contact. I missed the academic part of it, and I missed the procedural skills that I had learned. So I started dabbling in skin cancer. I had a patient ask me to take something off him, and initially said no. And this patient came back a few months later, and this thing had grown to a size where it now needed a tertiary referral center to fix it. The next time he grew something, he told me, "You taking this off?" I did. After getting him to sign a really good consent form, and I dived into skin cancer. Within the next week, he had told his friends, and this started growing. My skin cancer career then started growing, and it started overtaking my GP career until in 2014, I started working full time. Just before that, Keith Monington and I in Tauranga started working together and building a structure of support system for other GPs with similar interests. This led to the first college in New Zealand, which then amalgamated with a college, 2 colleges in Australia, and then the 3 colleges amalgamated to form one big, strong college, currently with over 1,000 members and lots of accredited members in that, which is something really to be proud of for all of us. I've grown since then, both in experience, in abilities, and I've made a full return back to teaching as well. I've taught all the courses, not all of them all at the same time, but in all the courses that the college represents or presents to you, and I enjoy that immensely. I've also been an active part of designing courses. Again, that's where the academic medicine part comes in that I really quite enjoy. And to me, skin cancer is really a perfect balance of everything I want to do in medicine. I can have as much academia in there as I want to. I can have as much practical procedural skills if I want to. I can do surgery all week if I need to. I can also do enough medicine in that and still have that ongoing patient contact that GPs love doing. And of course, then the teaching as well. I really enjoy the teaching. It is, I think, the best way to really make sure you can do something well is to teach it to someone else. And it has been a part of my process of growing into a better doctor and a better person since I started that. So thank you for the opportunity for all those who contributed. Thank you, Lynette.
Thanks, Franz. Thank you. So what we'd like to do now is look at some of the questions that we get asked over and over and over by our existing and potential members about skin cancer education. So I'll fire questions at our panelists and see, get the first-hand response. Charles, I'll throw this one to you. Why choose the Skin Cancer College, and why would you recommend pursuing skin cancer medicine to a colleague?
Sure. So one thing I found early on is, the Skin Cancer College, it's the only education body that actually has a pathway that ends in fellowship if you want to go that far. So that was something important, I guess, something that's a bit of a future-proofing thing for us as skin cancer doctors as well. The collegiality is also very important. It gives you the backup that you need from your colleagues, from the college and its members when practicing skin cancer medicine. As Lynette put it, it's a home for us that we can get support from, especially when you're delving into performing more advanced procedures like flaps and grafts, to have that backup of the college is important. Part of that process, as Melani's just has attained, and that obviously all three of us have, is to become an accredited skin cancer doctor through the Skin Cancer College, and that allows patients and other doctors know that you practice at this higher standard, and that they can expect that of you.
Thanks, Charles. Yeah, Melani, as someone who's just recently become an accredited skin cancer doctor, how does it make a difference to your patients? What benefit do you think it brings for them?
Well, I think for patients, it's good to know that when they come to see me, that I have done the process through the college. I had to do all the exams and pass it, and it's a high standard of degree. So I think the patients can feel more comfortable that they know that I am competent in performing the surgeries when they come and see me, that I have done the dermoscopy training, that I have done some surgical skills training, and just giving the patients that confidence.
Okay, thank you. That's great. Franz, what would you recommend to nurses about who might be watching tonight, and what is the value for nurses in improving their training in skin cancer medicine, particularly in dermoscopy? And we are aware that the scope of practice for nurses differs between Australia and New Zealand, but the skin cancer problem certainly doesn't.
Well, thank you. Yes, I think that nurses have an integral part to play in my clinic, for instance. Nurses do all the skin checks. Doctors do some skin checks as well, and that's important to keep your hand in. But the bulk of skin checks are done by nurses. These girls are trained, they do the same training as the doctors do. I also have multiple satellites where nurses go into GP practices, and then they go and do skin checks in that practice. And then, of course, if they find something, that practice can do the surgery if they can. Otherwise, they refer it back, bring the patient back to us, and we can do it at the main hub. Nurses are, I think, the mainstay future of skin cancer and doing screening. I think it's something that New Zealand is really leading the way, in that we can have nurse specialists who can go out and be extremely well qualified, really well trained, and people can trust. When we started, I thought that people would not go and see a nurse, and they would only go and see a doctor, because you go and see a doctor when you're unwell. Well, for screening, and same as for diabetes and women's health, all the other things, nurses have proven their worth, and we have people asking to see nurses instead of seeing doctors, because they build up a rapport with nurses and they get to know these nurses over time. I couldn't do without them, and I think really they are a major part of the future in skin cancer.
Yeah, I think it's important, just I'll mention there that certainly our education pathway in dermoscopy is open not only to doctors but to nurses, and we do get a lot of nurses coming through and doing extremely well in those studies. Charles, I might flick back to you as someone who's relatively recently become a fellow of the college. How long did that journey take you? And if someone was starting out now, what would your advice to them be about, the amount of time that they should realistically expect between starting into skin cancer medicine and potentially achieving fellowship?
Sure. So when I started, so I did my fellowship through, well, GP fellowship around 2012. So I already had about half a year of experience with skin cancer medicine at that point, working in a dedicated skin cancer clinic. I think you need to dedicate at least some time, probably more than 1 day a week, probably at least 2 days a week, where you're doing skin and getting good at it. So what I did was I think I did the certificates in 2014, and I eventually did the advanced clinical certificates. So the skin cancer one, and then the dermoscopy one in 2015 and 16. And then I think I had a break, and then I eventually decided to do sit the Part 1 fellowship exam in 2018. By then I thought my skill level, my knowledge was enough, and at least then you're required 3 years of full-time equivalent skin cancer work to even sit that exam. I believe that's still
so
the case.
in your case, Charles, you said it was a journey of 4 to 5 years from the get-go, really?
Something like that.
Yeah.
I ended up doing the OSCE in 2019. So that's when it.
And of course, in between that, you've raised children and moved house and done all the usual things that people do. So
exactly all the life stuff, and then with my wife also in specialty training, it's all that stuff to juggle.
yeah. But I think the bottom line is it is achievable. Yeah,
definitely.
Melanie, you also have an interest in aesthetic medicine. So how does your learning in skin cancer medicine complement the other aspects of your clinical practice?
Well, I think it's very important to have a good knowledge of skin cancer. If you do any aesthetic medicine, you see a lot of patients that just ask you if they can get their mole removed because they don't like it, or they just go to a clinic in the mall and get some treatment there. But I think it's very important to have the knowledge to be able to recognize if a lesion is benign or if it's cancerous, and before you step into any cosmetic treatment, it's important to rule out that it would be a safe procedure. At our clinic, we do offer cosmetic treatments, but they do not get any treatment before they are seen by one of the skin cancer doctors.
Right, thank you. And France, now you've been a fellow of the college for quite some time, so your skill level and knowledge is quite advanced. So how does the college assist you to keep up to date and keep your learning going?
Thanks, Ned. I think probably one of the most important things is the daily blog. I try and not miss the daily blog. I very often have time late at night or a few days later to read through it, but I don't think there's any blogs that I've missed in the years that I've been a member of the Skin Cancer College. Some of them might be a few weeks later, but I've certainly looked at each and every one. And there we have 1,000 members, all drained down to feeding into the blog authors and providing us with information of the best experience that you can get. I don't think there's a better way of gaining experience rather than looking at someone who's done it in real time and real life and shares that whole decision pathway for you. That, of course, and then also the courses that we've done, the master's classes, I think the Skin Cancer College has got an excellent selection of different courses of not just gaining knowledge, but also maintaining that knowledge in future. Then, of course, there's the, until COVID came along, the yearly conference. That has always been a high point in my life. Yearly conferences has been integral in learning more, and I've been actively involved, but also going there just to learn from other people has been a real privilege. Then the collegiality between all the members that I've come across is really good, because instead, anybody who's worked in a hospital has probably experienced hospital politics, and it's one thing that I've not come across between members in the college. If somebody has a problem, they are very often very feel-free and very open to discuss their problem and say, well, look, I've done this, the flap isn't quite working. What did I do wrong? How can I do this better? That communication between different groups of doctors and also feeding into the main group of doctors has been really excellent. So I think that this college is truly a college because we can all participate and we can all learn, and on so many levels.
Okay, thank you. Okay, well, we're going to change gear now, and we're going to give our panelists just a little break. We're going to hear now from our education manager, Mishka Penterex. Mishka is not a doctor. Welcome, Mishka. Mishka is an education specialist, and his role in the college includes reviewing and improving and monitoring the design and quality of our education program. So Mishka's going to give you some of the facts about education pathway that the college provides. Thanks, Mishka.
Let's try that again. Thanks, Lynette, and good evening, everyone. I'd like to thank the panelists for sharing their experience so far. A lot of what I'm going to touch on relates to some of the things I've said, but I'm going to go through the sort of standard education program, and we'll start with the education pathway in terms of how it leads to fellowship. We have some really amazing, high-quality, evidence-based courses, and the place that most healthcare professionals start, so that's our doctors and nurses that take these courses, is at certificate level. So we've got the certificate of dermoscopy. As Franz mentioned, that's something that nurses can take as well as doctors, and it's a place that we recommend that you start regardless of where you are in healthcare. However, you can also take the certificate of skin cancer medicine first. One thing to point out is that the certificate of dermoscopy is fully online, whereas the skin cancer certificate of skin cancer medicine is a face-to-face course currently. So these are courses that you'd take as Charles maybe did, sort of within a year, and this is something you could do in a short amount of time. So 6 weeks for the certificate of dermoscopy, and it's a 2-day face-to-face course for skin cancer medicine, but there is a 6-month period of assessment that comes after that. Once you've completed both the certificate level courses, you can move on to the advanced clinical level. And these are 6-month-long courses. So Melanie touched on these. I've got your pronunciation of your name wrong, apologies. these are courses you take. They're 6 month long. They're very advanced level. And once you complete both of these, then you are an accredited skin cancer doctor, or you're eligible to become an accredited skin cancer doctor with the college. Moving on from that, then you might choose to, as Charles and Franz did, go on to fellowship level. And I'll talk about accreditation and fellowship in just a second, but I do want to move on to talking about recognition of prior learning, because it's a question we get quite frequently. So recognition of prior learning, or RPL for short, is a process the college has for evaluating other skin cancer medicine education courses. So if you've done a course with another education provider in skin cancer medicine, then we can look at that course and evaluate sort of what level it is compared to our own courses. Okay, if this is something you're interested in, and many students come to us interested in this, we have a web page on the college website that explains the RPL process, explains the terms and conditions, and there's an application there, which if you've done a course, you can send that application in with your certificates. We'll have a look at that and help you understand where you fit in terms of our education pathway. So that might be something that people listening tonight are interested in, and certainly I would then encourage you to go to the website and have a look at what's available. RPL does require a small fee. It's not the full course fees, and some assessment. So that's something you should look at again on the website. All right, I'd like to move on to talking about accreditation now. And as I mentioned, the sort of pathway to becoming accreditation starts with you becoming a member and the certificate level courses. So you complete those and you move on to the advanced level courses. And here you can see the sort of indicative time frame for how long you should allow for each of these courses. After you completing all of these courses, and again, you're completing both of the advanced clinical certificates, you are eligible to become an accredited skin cancer doctor. Now, the benefits of doing this are something that Melani's already sort of really highlighted quite well in her talk, but I'll just summarize them again. So you've got the concept of, and I think Charles mentioned them as well, quality assurance. You're standing out as a recognized skin cancer doctor. You are on the college's locator doctor service, and that allows patients to find you and patients to be assured that you have the knowledge and skills to treat their skin cancer medicine, and to sort of really provide that quality assurance. So again, our panelists have highlighted that really well, but I think it's worth going over again. All right, let's move on to talking about fellowship. And I think, again, our panelists have highlighted this already fairly well, but you know, as Charles mentioned, fellowship, it's the pinnacle of primary care skin cancer medicine expertise. Our college fellows are recognized for their expertise and their leadership in skin cancer medicine. And you know, many of them, as Charles and Franz have alluded to, go on to teaching and presenting, and with Charles becoming an author of our prestigious blog. However, it is a long process, and you can see that after becoming accredited, as Charles talked about, there's a little bit of a process. You sit a Part 1 exam, which is an exam that covers a broad range of topics in skin cancer medicine. There's a number of clinical cases that you need to complete. You can see there are 45 cases and an audit of 300. And then at the end of that, and 3 years of, at least 3 years of skin cancer medicine practice, you can sit the OSCE exam. Right? And achieving that, completing all of that, makes you a fellow of the Skin Cancer College Australasia. It is a sort of an amazing pathway, and the doctors who complete this are, you know, have a strong commitment to skin cancer medicine, to study and to sort of further practice. So if that's something you're interested in, again, please have a look at our website. There's a good deal of information there. All right, there's a couple of more things that we want to talk about really briefly. Let's start with talking about our amazing blog. Now, Charles and Franz both mentioned this. Franz mentioned that he'd read all of the blogs. We've got about 3,000 now in the library, so that's an amazing achievement, Franz. It is a really amazing interactive library, or if you like, an encyclopedia of skin cancer medicine. So in those 3,000 cases, there are many that deal with surgery, with diagnosis, with histology. And as Franz mentioned, that cases are posted daily. They're interactive. So the blog authors post something, they post some questions, and you have an opportunity as a member to ask questions, to pose ideas, to post your own thoughts on what's going on. So it's this really interactive learning opportunity. And to then learn from the expertise of the blog authors. And so it is a truly amazing learning resource. If you're a member, I would encourage you to read as often as you can. If you can beat Franz's record of reading them all, that would be amazing. And if you're not a member, then to me, the blog alone is reason enough to become a member of the college, because it is such an amazing learning resource, this encyclopedia of skin cancer medicine knowledge. So definitely worth checking out if you haven't. All right, and finally, I'll talk about briefly our skin cancer medicine webinars, which are a little bit newer than the blog, but still really popular. So unlike this one, most of our webinars focus on, have a clinical focus. So some of our recent ones looking at, you can tell they're looking at surgery, looking at histology, looking at the pathology report. So these are really popular, they're well attended. Anyone can access them, anyone who's interested, if you can access them live. But members have access to the past recorded webinars as a library, and they can access them anytime. Topics are chosen by interest in terms of the members. All right, we also have other educational opportunities, and again, our panelists have mentioned these. We have our yearly Skin Cancer Congress that's held every year in May. Obviously COVID permitting, but we did hold it this year. We have some amazing peer support opportunities, patient resources, clinical resources, and many, many more. So it's worth certainly checking out. If there are things that you're unsure about, the education site has our contact information, and you can certainly send us an email and ask questions anytime. All right, thank you very much, and I'll hand back to Lynette and the panelists.
Great, thank you, Mishka. That was really good. What we're going to do now, we're going to return to our panelists, and we're going to answer some of the questions that have been sent in advance by you, our webinar attendees. And we'll start with one for Melanie. How did you get exposure and experience in surgical procedural skills, particularly whilst you were studying with the college and therefore needed to send in case studies? You're muted, Melanie.
There we go.
Good.
So I made sure at first that I could do the basic surgical procedures well, all the ellipses, be confident with that. And then I did attend the surgical workshop. That's part of the advanced course. That is a 4-day practical course, but it was so informative. You learn so much, and it really gave me a lot of knowledge as well as confidence to go back and to consider doing some of the skills. I was very fortunate that I did switch over to a clinic where I worked with a very experienced skin cancer doctor, and often would watch his procedures that he did, asked a lot of questions, see my patients, and take photos of the lesions, print it out on a printer, take your textbooks, draw all the different options. It was very good to do the advanced course and have the tutor also available to discuss the options with. And then to go in, also to practice at home, buy a Pig Valley and practice it at home, and then make sure that you have some backup. Discuss with someone if you can that you are going to do the procedure. That if something does go wrong, I knew I did have a doctor there that was a backup. So that gave me confidence to try more advanced things.
Thanks, Melanie. Franz, a question that often comes up from people is how do they find a mentor to help them along that pathway? Because Melanie just mentioned the importance of having that backup. So you, as someone who potentially is a mentor for others, how does someone starting out find that?
Well, a lot of the people that come to my clinic and do to get some experience, I've either taught in the different courses or networked during conferences, or I just get a phone call from someone and they have a problem and they send me emails. So the most important thing is start networking. Find someone and find 2 or 3 people that have more skills than you've got, and then you can contact them and get 3 opinions. You can get 1 opinion and maybe go and visit. In my clinic, we have lots of frequent visitors coming just to watch, just to participate, and learn. You can also come and spend some time there. Spend a week there if you want to. There's lots of options available. It's becoming easy as well. When I started, and I was, before I did my fellowship, and it was really difficult. We had to go and beg the local plastic surgeons and surgeons to please show us how to do a procedure. Very few of them did. There were some very excellent people who were very collegial and did show us, and that was worth it. Going there to beg them, buying the coffees, taking the cake, buying the muffins, and going there to learn from them. So thank you to them, but also passing it on is a really good experience. So find someone, go to the list, find someone who can do this procedure. Go look at the blog. If there's a procedure there that you see someone's put in the blog, they obviously have had quite a few people comment on it, and there was something to learn from it. So go and find the procedure in the blog, contact the person who put it on there, and get some more information. If you ask around a network, there will be people not too far from you that you could contact, and either in a Zoom meeting or even face to face, you could contact and go through the whole procedure.
Thank you. Charles, a question that's come in is, how did you prepare for the fellowship exams, and how did you gather all those cases that are needed for the fellowship log?
Sure. Good question. Time. So basically, so look, fellowship is, you're supposed to use everything and anything that's available to you. So one thing I use as a foundation basically were my module notes that you get to access after you complete the advanced clinical certificates courses. So using that as a foundation to read back up on the dermoscopy one and the skin cancer medicine and surgery one, and then you can use that, and there's links and things on the courses to then branch out. So I use that as my base. Then I would plug some knowledge gaps that would come in with journal articles, and obviously some of the textbooks that are recommended during the courses as well, such as Reigel's Cancer of the Skin, Harold Kittler's and Cliff Rosendale's dermatoscopy books, surgical texts such as Cantor, Paver. Paver's great. It's got videos as well that you can look at for for your flap procedures. and Vinomos, a very good one that used to be recommended text for one of the courses as well.
Yeah.
Reading the Cancer College melanoma and keratinocyte guidelines is also very important. And one thing I can recommend when studying for the actual OSCE, James Bricknell's got a fantastic ebook accessible through Kindle, and that's got a lot of cases and a lot of notes on it. And yeah, that was the main things I used.
Just on that, anyone who's listening who is interested in pursuing fellowship, there is information, a little bit of information on our website, but I do strongly recommend that get in touch with the college directly, because we like to know who's potentially interested in pursuing fellowship, so we can keep in touch with you. We do have a detailed booklet that we can send out to you that gives you quite a lot of information about what the fellowship pathway involves. The reason we don't make that just available, at a click on the website is we like to know who's interested so that we can give you advice, support, connect you with mentors potentially, and so on. So if you're interested, just do get in touch by email or phone. Okay, looking at the time, I think what we might now do is invite Kim, our marketing manager, who's been diligently monitoring questions in the background. Hi, Kim. Just to direct to the panel some of the questions that have come in whilst we've been talking. So I'll hand over to you, Kim. Thanks.
Thanks, Lynette. We've had quite a few questions come in on the live chat, and I'd just like to assure everyone that if we don't get to your question tonight, we will respond via email and make sure that we get back to you so your questions will be answered. Franz, if I could start with you, there's a question that's come in. What level of knowledge should I have before starting unsupervised full body skin checks? Sorry, that's come from Sam in New South Wales.
That's a difficult one, because you could never know everything, and whatever you see, you should not try and diagnose that something that you don't know. One of the most frequent mistakes that people will do is they've done a weekend course, they've got a lot of knowledge, and they often become very confused after the weekend. They go and see something, and they see something that they think is okay. So there's a few principles. When you can go out and diagnose anything that you know that you've had the training to and you're confident in diagnosing, and then that can lead to treatment. You should never go and treat anything that you can't diagnose, because then you're looking for trouble. So my advice is always to do one of three things. If you don't know what it is, you can bring the patient back in 3 months and see if it's changed. And because you suspect it's a seborrheic keratosis, but you want to make sure it's not a melanoma, you can get someone who is more qualified and especially more experienced and trained than you to get them to look at that as well. Or you could go and earn a side of caution and cut it out anyway, and then you get the histology results. But you would never go and say, well, if it was a lesion that you're not absolutely sure of the diagnosis, and say, this is not a melanoma because it's got this. You need to be pretty sure before you can do that. So the level of experience grows over time, and your breadth of what you can diagnose and treat grows continuously. Mine is still growing after 20 years of doing this. And so it is a long process. It is an exciting process that starts and builds and snowballs into bigger and bigger things. And enjoy the ride, but don't overstep, otherwise the snowball is going to catch you from behind.
Sounds like good advice. Melanie, can I ask you, this is from Keith in South Australia, wanting to know, did you work across multiple skin cancer clinics or GP clinics during your training? So while you were doing your courses?
So I started working at a GP clinic that started out new, and we opened up a skin clinic there that the GPs had turns to do skin clinic there once a week. So I did work out of that one. And then I decided that one day is not enough for me, and that's when I started looking for skin cancer clinics. And I did work out of the regular GP clinic, doing some GP work, 1 day a week, my skin clinic, and then 2 days a week at the skin cancer clinic, and then gradually decided that I could resign my job at the first clinic. So I did work out of more than one.
Okay, great. Thank you. Charles, we've had quite a few questions about how to get experience doing flap and graft surgery. What is the best way to get that experience?
Sure. Well, I guess the first thing is you need to know the flap knowledge. You know, you need to know how to do it before you have the scalpel in your hand and the patient in front of you. So, so a good start, obviously, obviously the courses the Skin Cancer College have, particularly that advanced surgical workshop that Melanie told you about, the 4-day workshop that teaches you a lot of that theory, and you can practice on pig skin. But look, bottom line is what I did and what I found was very useful is obviously if you do have someone who knows what they're doing. For instance, I had Dr. John Koo, who I work with still at Skin Sense Clinic. He was doing 5 years of full-time skin cancer work before I started. And so, what I would do is I would have a potential lesion that needed a flap. I draw up my plan on the patient. I could call him over and say, look, here's this lesion. I've drawn up this flap plan. What do you think? And then he'll either go, okay, yeah, I think that's fine, or he'll tweak it and go, yeah, I think that's good. And he's got them as a backup. But if you don't have someone, next door, or, as Fran said, there's a lot of us out there who can provide that sort of, understanding. So a lot of my students that I've had in the skin cancer, the advanced clinical certificate course of skin cancer medicine surgery, I would get them to email me photos, clinical photos, and go, look, what should I do with this particular lesion? And I'd use my photo editing program and go, look, I think you can do this, you can do that, and he'd send his stuff, and you back and forward a bit like that. So that's one way you can do it also remotely, and one of the advantages of having a tutor as well. But other things like the flap books. So know the theory in the flap books, and Paver's flap book, as I said, has a lot of videos that you can read. And when you know what the lesion's going to be, it's kind of site specific. So you can go to that chapter, you can go to that video, and you can watch the video, and you can see how it's performed. Particularly if you're a visual learner, that works quite well. And but I think the main thing, as Fran said, is don't step over what you know. Don't do something that can land you in hot water when you don't have any backup. And that's, I think, one of the more important things too.
Go ahead, Franz.
Yep. One of the things that works really well in my clinic is when somebody joins my clinic as a doctor or a nurse, they go through a whole process of learning. And we start with the basics. Whenever they do a certain procedure, whether it's a bilobe on the nose, they would first do the training in the Skin Cancer College. They would then assist someone who's done it before. Once they're capable they've got the mechanics of it, they then do it with someone assisting them. And that person assisting them has got more experience than they have. So the two of them, they can be guided, get a hands-on experience. And that to me is the best way to learn. Because if you compare doctors locally who have gone out and learned on their own and only done the courses, they take a lot longer to get to a certain level of proficiency compared to doctors who are actively encouraged to teach and learn from someone on a daily basis. So the ideal place to learn would be to go and spend some time in a skin cancer clinic where there's someone that you can trust, someone you can learn from, and you will grow quickly. And it's a lot safer as well.
Yeah, agreed.
Lynette.
Hi, I'm conscious of time. We do try to run on time for these webinars. I'm sure there's a lot more questions, a lot more chat that could go on. But as I mentioned, we have captured all the questions. We will get back to people if questions have been left unanswered. So I'd like to wrap it up by just saying, do please stay connected. If you're not a member of the college, you've heard plenty of reasons why we encourage you to join now. Get started on your skin cancer education journey. There's lots you can learn. And when we conclude this webinar in a moment, there will be a very short survey. I promise it's 30 seconds. We would really appreciate your feedback by answering those questions. And finally, thank you very much to our panelists tonight for all your answers. And thank you also to Kim and Mishka for your contribution. And everyone who's listening, you will receive a link tomorrow to the recording of the webinar. So on that note, I'd like to say again, thank you to our panelists, thank you to our audience, and good night, everyone. Thank you.
Thank you.
Good night.
Everyone.
Good night.
Good night.
Thanks.